Hello and welcome once again to Strong at Home. I'm Dr. Brenda Murphy and I'm an educational psychologist with Sail Away Learning and Academy. We are so glad that you've joined us for this edition as we are going to continue our conversation with Dr. Erin Plyler. Hello, Dr. Plyler. Thank you for joining us again. Dr. Plyler is an audiologist at the University of Tennessee in Knoxville, and she is a pediatric audiologist, and she has been sharing with us some amazing information about hearing loss, normal hearing, and how it's not really our ears that hear, but it's our brain. And so last time we talked about the diagnosis or description of this brain problem. It's a brain problem, not necessarily a hearing problem, called auditory processing disorder. So it's really that middle word, processing, isn't it, Dr. Plyler?
Hi, I'm glad to be back again. And yes, you're right. It's the processing that is deficient in these children. And so, as I said, an auditory processing disorder is really when the brain can't hear. But I also want to say there's nothing wrong with their brain. Their brains are normal. They're just a little bit delayed.
And in that delay, you explained to us in a prior session that little bit of delay can be matured. And I believe that we discussed that at some point that will disappear if it's a maturation or a growing process. Because for me, it was like to see a seed growing, that at some point, most trees in the forest look like the same size. We know they're not exactly, but they're all functioning the same. Or, we're planting tomatoes, and maybe the one that's the littlest one grows and produces plenty of tomatoes. So is that kind of the future look and future hope for children that are diagnosed with a central auditory processing disorder?
That's exactly right. What we see is about 60% of our kids that we diagnose with an auditory processing disorder will outgrow the disorder. The other 40%, the reason for their processing disorder is not because of a maturational or maturity of that central nervous system, but it's something has happened. For example, they had a stroke in utero. There's damage somewhere in the cortex that secondarily they have this auditory processing disorder, but it's not because of a maturational issue.
But it is a brain issue. It's not an ear problem. It's a brain problem.
Correct.
So what we discussed before was that there's the peripheral, which is the hardware, so to speak, with the ears. But then there's the kind of the software in the brain. And if there's a problem with the software, then we have some problems. And I'm definitely not a programmer or an IT person, but I know that that happens in different parts in a computer. You can just unplug something and replug it. And so what I'm hearing you say, if I'm correct, that the brain is kind of like that when it comes to this auditory processing issue, that it's different parts of the brain.
Mm-hmm. Absolutely. And the job as an audiologist is to try to determine what part of the brain is not functioning the way that we want it to.
Well, we have a graphic, I think, of kind of the brain with, and there it is. We're going to talk about that there are, how many different types of auditory processing disorders are there?
There are 3 primary types of auditory processing disorder. And this picture kind of looks like the picture we had earlier, where we have the ear, and that would be our peripheral. And those red lines going up just indicate that central auditory pathway leading up to those 2 red blobs, which will signify our cortex.
Yes. And what I notice here immediately is that the right ear, that little red line is going up and across to the left, and the left is going up and across to the right.
Yes. And those are those crossed pathways that we talked about last time.
Yeah, we did. We talked about the importance of
Mhm.
making those crosses happen by crawling as a baby. So if any of you have babies out there, take those walkers away and put your babies on the floor and show them how to crawl.
So important.
Okay, but that just struck me, and I thought, oh, that's really important. So let you continue. This is really fascinating.
Okay. So we have 3 types of auditory processing disorder, and each type is based on where the breakdown is occurring. So if you look at that left ear and go straight up, that is that left hemisphere of the brain. When a problem is there, we call that a decoding type APD.
Decoding. Okay. And that has to do in my field, because when I talk about decoding, I'm telling or helping parents teach their children how to read words.
Mm-hmm. The left hemisphere, when we see that type, it's very language based.
Yes.
We are going to be good at art and music, probably. We're not going to be very good at decoding words, segmenting words. We are going to mishear a lot of what is said. These kids are going to be the ones that are saying, huh, what? I don't understand you. So they're going to act like our kids that have that peripheral hearing loss.
Oh, can be very confusing, can't it?
Yes. Yes. Where if you go to that right ear and go up, that's that right hemisphere. If all the problems I see are in that right hemisphere, we just call that a prosodic type.
Can you explain that term to me a little bit?
Yes. Those kids are going to be completely different than that left decoding side. These kids are going to be the kids that have some social pragmatic problems. These are your kids that are going to be very poor with art and music. These are the kids that heard every word you say, but they are misunderstanding what you mean by those things.
Are they maybe kids who can read very rapidly but don't understand a thing they've read?
Correct.
Okay.
Those might be those children.
Yes.
Yes. Now, the middle space kind of between those 2 hemispheres, if all my testing showed problems in that area, then they would just be called integration type APD.
Right.
This is really the most common type of APD because that area that you're looking at is the last place to become fully mature within that central auditory system. Unfortunately, it's also the hardest one to have in the sense that they kind of have both areas not communicating with one another and have all those issues.
Oh, bless their hearts. Oh my. That really is a complex problem. And again, I want to reiterate, I think that I'm correct, that this has nothing to do with their intelligence, their cognitive abilities. So lots of signals are getting crossed up and mixed up, and they're really still very bright young people. Is that correct? Am I correct in my assumption there?
Absolutely. IQ is perfectly normal. A lot of our children are smarter than normal. They are very intelligent kids. They just have pathways in their brain that are a little bit delayed, no fault of themselves. And we just want to get those pathways working faster and catch them up.
Wow. Yeah. So the ones that have both the integrative type, and you said that's the majority of them. So is it difficult to separate out if could it be that maybe one has a greater problem, say in the right hemisphere than in the left? So there's all across the spectrum of possibilities that there are children that represent many different issues with auditory processing from that integrative type?
Yes, and one thing I also want to note about the integration type, when we see kids that have this integration type of APD, it also goes hand in hand if a child has a diagnosis of an ADD or ADHD. They will most likely, if they have an APD, this is where it will be.
You must have been reading my mind, because I was thinking, how does ADD and ADHD factor in with all of this? So for a diagnostician like yourself, how do you tease out, is this ADD or ADHD, or is it a true auditory processing disorder?
There are several characteristics that are the same between the disorders. Both can be distracted, both might be daydreaming, but at the end of the day, an auditory processing disorder is a problem with the input of that signal going up to the brain to be analyzed, where ADD or ADHD is a problem with the output of their behaviors. So one is an input disorder and the other is an output disorder. So they can have both, or they can just have one, but they're two distinct disorders.
If for you, in your long experience as a pediatric audiologist, what are maybe some of the things that you can immediately help distinguish between those two common diagnoses?
So if a child comes to us and they have not been diagnosed yet with ADD or ADHD, they obviously would not be on any sort of treatment or medication.
Right.
When we are testing them, they will not sit still for the testing in the booth.
Yeah.
They are very fidgety. They want to rip their earphones out. As soon as we go back to put them in, they've taken them out. They just can't really sit still to even pay attention to the test. When we have a child that doesn't have ADD or ADHD, they usually will sit there quietly and listen and participate. And so we can quickly tell which patient we need to maybe make a referral for.
That's very cut and dried. I had no idea. And so parents, it's really important for parents to recognize that there may be many different things going on with their child. And I think in our first session, we actually talked about the importance of an interdisciplinary team in managing these children that are showing very different kinds of behaviors, and coming into this. So one of the things I hear you say is that if a child is primarily auditory APD, that they are maybe able to control fidgetiness or, moving around. And maybe that would be a place that if parents are concerned with, well, what's really going on with my child, that if they aren't paying attention and they aren't hearing, but yet they're pretty quiet, then maybe it might be to start with an audiologist. But if they're bouncing off the walls, then they may want to go to a physician or to an educational psychologist like we are, that might be able to say, well, that's probably an attention or an ADD problem.
Exactly. And, when you do go to the different professionals, it's very helpful if you take your reports from the other professionals with you. Because what we like to see is that all of them together make sense.
Yes, I agree. Because as an educational psychologist and an educator, I'm often getting combinations of tests, and it's good so we can all put them together and see where they may overlap. And testing and evaluations is so critical in this process and finding the best plans going forward for our children. So we are, believe it or not, we're out of time again, Dr. Plyler. But since that's such a critical issue, let's talk about that on another session of Strong at Home, because I think parents could benefit from understanding a little bit more about assessments, especially for auditory processing disorder. Would you be willing to do that for us?
I would love to.
Okay, well, I will end our session as we do always here on Strong at Home. The Lord bless you and keep you. The Lord make his face shine upon you and be gracious to you. The Lord lift up his countenance upon you and give you peace. Peace to you, Dr. Plyler, and peace to all of you out there. Have a wonderful rest of your day, and we'll see you soon. Bye-bye.